All right, thanks, Amy. Good afternoon. Thank you to everyone for joining us today on this hot afternoon. Hopefully, everyone is keeping cool. We are happy to be able to offer another session of our Workforce Collaborative Training Series to our dedicated providers in our community. Today, we are excited to have Erin Parr back with us again. She's the SAFER Project Director with Horizon Health Services, and she will be talking about Cannabis 201, the blunt truth. Just a few quick reminders. At the end of this session, we will be asking everyone to complete a very brief evaluation. We hope that you take a moment to fill this out so we can continue to improve our series. Our next session will be on Tuesday, July 22nd, and it'll be an introduction to the mental health crisis triage tool. Be on the lookout for registration information. It will be emailed out and posted on our website soon, but we will be posting that registration link in the chat at the end of the session. The recording and slides from today's presentations will be posted to our website within the next few days. The presentations and recordings for our past offerings are posted to our website as well, so we'd encourage you to check those out. We are continuing to fill our calendar for 2025, and we are interested in hearing more topics and speakers that the community would like to hear from. If you're interested in doing a 1-hour presentation or you're interested in a particular topic, please put that on your evaluation, or you can contact Amy at amy.rockwood@erie.gov. Our training is being recorded and everyone is muted. Erin will be leaving time at the end of today's presentations for questions and some discussion, so we will have questions at the end. Thank you all for joining us today, and I'd like to introduce Erin Parr to talk about Cannabis 201, the blunt truth. Thanks, Erin.
Thank you so much, Kathleen. I am so excited to be welcomed back again. I know that the last time I was here, we covered a lot of the cannabis basics, and it was a really interesting and informative presentation. I'm so happy that everyone has found it useful and invited me back, and it's just such a pleasure to be here. Thank you for spending your lunch hour with me. So next slide, please. I am from Horizon Health Services, and we are the largest behavioral health organization in Western New York. We offer support to individuals and families who may be impacted by mental health and substance use, and we are actually celebrating a huge milestone birthday this year. It is our 50th anniversary in the community, so stay tuned in the behavioral health world in the news for some events that are coming up this year related to our 50th anniversary celebration. So just a little plug for that. Next. So as Kathleen mentioned in my introduction, I am the project director for a new program called the SAFER program at Horizon. We do early intervention around substance use with adolescents and children ages 10 to 25. Our team primarily focuses on cannabis and vaping interventions simply because that's what we're mostly seeing in the community. But I've been doing early intervention for quite some time. This is a new program for Horizon, but most of my clinical experience actually is from my time living and working in Canada. I am Canadian born and spent a good chunk of time in Canada before immigrating here, working on early intervention programs, both inpatient, outpatient, psychiatric programs. And as a default of that job, the majority of my caseload, the majority of my patients ended up being young people who were experiencing acute mental health crises and adverse consequences related to their, their use of substances, their pattern of substances, and that main substance of use was cannabis. So I accidentally fell into a specialization that involved cannabis use disorders. And then, Canada legalized cannabis recreationally, federally in 2018. And being one of only a few clinicians in the province who really had this specialization, I started speaking on the topic and sharing all of my knowledge, education, resources. I was nicknamed the weed girl back in Canada, but my American colleagues have decided to upgrade me and have given me a much more regal title. So I'm now known as the Cannabis Queen, and I'm happy to share all the cannabis knowledge that's in my brain with everybody today. So next. I just want to acknowledge that there are lots of different perceptions about cannabis in the community, and cannabis as a plant and as a substance wears many different hats. And so what we've noticed since legalization in New York State is that there's been a cultural shift with cannabis leading to a growing perception of safety. So I want to acknowledge that, there are legitimate medical interventions for some, physical health conditions and mental health conditions that cannabis can be clinically indicated for. I fully acknowledge that there are some therapeutic uses for cannabis, and I validate those who have done really solid and rigorous research in that area. Although I'm going to be touching on those medical pieces a little bit, I also want to just say that this presentation is intended to offer a balanced perspective and a balanced perspective to some of those mixed messages that are present in the media around cannabis's perceived safety. And those messages often focus on the highs, pun intended, right, rather than the downsides of cannabis. And so caution really is necessary just to support public safety and encourage people to make the safest possible decisions for them. So I think we can use the chat here just to get a little audience poll. I'm just curious if we can move to the next slide. Who was here for Cannabis 101? So if you were, please raise your hand. Anyone who attended the first time around? Yeah. Amy and Colleen, I know you were with me the first time around for sure. I don't know if I can see people's responses, but just curious if there's a number of hands popping up there.
Yeah, one comment, I was present. A couple thumbs up I see.
Okay, awesome. All right, thank you. And then if someone could give me a rundown of what the answers are for the next question, is there anybody, oh, there we go. Now I can see the messages. Is there anyone who lives within 5 minutes of a dispensary now, like a cannabis dispensary? Oh my gosh, yeah, we got a good number.
A lot of yeses and thumbs up right now.
Right, right.
Yeah.
Okay, so yeah, a huge shift in the cannabis landscape, right, in our community. I can actually see my local cannabis dispensary from my back bedroom window. It is very close. I live downtown Buffalo on the west side. I've actually made friends with the owners of my cannabis dispensary for educational purposes only, and collaborating around educational needs in the community, and also doing research. And so as we all know, the dispensaries have popped up. It's been a huge shift in our community. And this spring, the Office of Cannabis Management issued 300 new licenses, legal licenses for both cultivators and retailers. So the industry is just continuing to grow. Okay, next slide, please. So today is Cannabis 201. I'm going to be focusing a little bit more on the differences between medical and recreational cannabis, the impact across the lifespan, and then we are going to talk about some safety considerations and harm reduction strategies, as well as some of the implications of legalization. There's always unintended consequences every time a new law is passed. Next slide, please. All right, so very, very brief history of cannabis. And again, this is not like a full history. I've actually edited a few things out here, but cannabis has been around. The seeds date back to about 3000 BC in the tombs of old kings, right? And back in the day, and I mean really, really back in the day, cannabis and hemp products were largely used medicinally and for like products to create, ropes and fabrics and things like that. It was brought to North America by the Spanish in the 1500s, and then cultivated by colonial farmers here in America in the 1600s. And actually, George Washington grew hemp. He was a hemp farmer before he was the first president of the United States of America. But things began to shift around the turn of the century. So around 1900, the poison laws were put into place. And these were laws that were banning both cannabis and opium at the time. And in 1937, the Marijuana Tax Act was implemented, and it banned the sale, possession, and transport of all cannabis and hemp products. In 1941, even though cannabis had been used for a very long time medicinally, it was banned and removed from all pharmacopoeias, which are the Bible that pharmacists use and doctors use to prescribe medicines to their patients. In the 1970s and 80s, it was the war on drugs era. So, cannabis was still very much illegal. And then in 1996, California was the first state to shift and move to medical legalization. This was followed by New York State medically legalizing in 2014, and now we have New York State having recreationally legalized in March of 2021. I cannot believe it's already been 4 years. It's been like a blink. It feels like it just happened. All right, next slide, please. So the important thing to know in terms of what's going on clinically is that the clinical train has left the station, right? Prescribing for, medical cannabis and the use of recreational cannabis for individuals who are attempting to self-medicate particular symptoms that they might be struggling with. This has been going on for some time, right? So the clinical train has left the station and scientific research is really just trying to keep up, playing catch up. So there are some there are some conditions for which cannabis does actually have some good medical evidence to support its effectiveness as a treatment. There are some conditions that have no evidence for cannabis being helpful. And then there are some conditions where there may be emerging evidence that cannabis could be helpful. And ideally, right, we all want better treatments, right? When CBD first came on the market, which is a cannabinoid that is non-psychoactive and has, therapeutic components attached to it. I know in the world of psychiatry, many of my patients were thinking, CBD is the answer. I can, consider, either removing or slowing down or, stopping my psychiatric medications. And, we need to be very cautious around things being kind of marketed as sort of like a panacea, right? Or a magic pill. We all want better treatments and we all hope for better treatments, but hope is not a substitute for good, rigorous science. And so I really am trying to just present the facts here. And I'm going to talk a little bit about what medical cannabis looks like in New York State. So next slide, please. Medical cannabis, with legalization of recreational cannabis, also came an expansion to the medical cannabis legislation in New York State. So things changed for everybody back in 2001. And now, instead of there being a very restricted number of conditions that cannabis can be medically prescribed for, there's now an expansion of those medical conditions. So there's greater medical product variety as well. Given that legalization has happened recreationally, there are more products that someone using medicinally can now get access to. There are increasing dispensing limits, so people can now get dispensed a 60-day quantity of medical cannabis. There are now on-site pharmacists. There's actually no minimum age limit with caregiver designate. So that means that essentially patients who are under 18, minors, can access medical cannabis with the help of a parent or caregiver. This is a huge change to the medical cannabis laws. There is now home cultivation permitted for individuals that are looking to grow their own medicinal cannabis sources, and individuals can smoke whole flower medicinally, which is not something that was something that was restricted previously. Next slide, please. When we are talking about medical cannabis, as I mentioned, there are a number of conditions for which THC is considered to be therapeutic for, and then there are a larger number of conditions and benefits that are related to CBD. And this infographic does a really nice job of showing what those effects are. So CBD is purported to be antidepressant in its effects. That also goes along with anti-anxiety, right? That works on the same neurotransmitters. When you reduce depression, you tend to reduce anxiety. It can suppress seizure activity, so it's an anticonvulsant. There are other benefits in terms of it being an antioxidant, a natural antipsychotic, being neuroprotective, helping with inflammation, also helping with nausea. There are also some anti-tumoral properties associated with CBD. Again, these are tumor inhibiting properties. Please don't misperceive my words. I'm not saying that CBD cures cancer. It just can inhibit the growth of tumor cells in some studies. So on the flip side, THC is helpful for pain relief, relaxation, inducing sleep, euphoria, creates a high, and then it also can assist with appetite stimulation. So you can see that the benefit profiles are a little bit different when you compare CBD and THC. I do have some cautions related to CBD in the next slide, and those cautions are that CBD is Only effective and safe if you are obtaining a effective and safe product. So 80 to 90% of CBD on the market that's sold in, smoke shops or, oil stores is essentially snake oil. The FDA issues monthly warnings around CBD products that are either contaminated, mislabeled, have THC in them when they shouldn't, have very little CBD in them, and or are making claims on their packaging that are incorrect or erroneous, that they can treat or cure or support certain symptoms where there's no evidence to suggest that they can. So if people are looking for CBD, please be sure that you're getting it from a reputable medical grade, pharmaceutical grade provider that can show you third-party testing so that you know what's in it and that you are getting the safest possible product. We're also not clear what the dosing is like for CBD for children. There's not a lot of research on that. And we also are not, it's not well understood how CBD is absorbed and what kind of delivery systems how much of that CBD is actually delivered to the brain, because CBD receptors are generally in our body and they work indirectly on the CB1 receptors in our brain. So there's still more that we need to understand. Next slide, please. CBD does have some medicinal uses, and the disorders that I've highlighted bolded are the ones that we have the best evidence to support. So that includes seizure disorders, inflammatory or neuropathic pain, and then spasticity related to multiple sclerosis or other spinal injuries. Next slide, please. The medical uses for THC, again, the bolded diagnoses are the ones that we have the most research supporting, and that includes, again, neuropathic pain, inflammatory pain, nausea and vomiting, and wasting syndromes related to either side effects from cancer treatments or, HIV/AIDS related symptoms. And I'd say the other, although I didn't, highlight it, the other common use for THC is actually the treatment of nightmares in individuals who are experiencing trauma. So THC used before bedtime can inhibit the retrieval of memories. It suppresses your short-term memory and can prevent dreams or flashbacks from occurring while somebody is sleeping. So often people who have trauma diagnoses might be gravitating towards using THC at nighttime, right, to help with relieving these symptoms. There are a couple of FDA approved medications that are THC, that include THC, and those are Succinate, Marinol, and Syndrose. All right, next slide, please. Some people have been supporting the use of medical cannabis as a harm reduction alternative to some other pharmaceuticals. This is a common trend that we're seeing. I certainly see it with some of my patients where rather than use benzodiazepines or alcohol or opiates, they're shifting to cannabis as a harm reduction alternative, an alternative to tobacco in some cases. Their perception is that it's a safer alternative to pharmaceuticals, but that really depends on your personal risk factors and the type of product that the individual might be using. And so, in some cases, it might be a legitimate harm reduction choice, right? To go from, tapering off opiates, which we know that can be highly addictive and have a high overdose potential, to using cannabis related products to manage either mental health concerns or physical health concerns. And I've had some patients do that really well, and they're able to manage and monitor their cannabis use quite safely. But then at other times I've had patients, attempt to move to cannabis as a harm reduction strategy. And then the cannabis use itself, although intended to be medicinal, does end up becoming problematic. So it's really different for each person. And if an individual is going to make this jump, we really encourage, in addition to the use of, shifting to medical cannabis, that they pair that with psychoeducation, counseling, and ongoing monitoring for support to make sure that we are also supporting and encouraging that person to use in the safest possible way to avoid dependency and addiction. All right, next slide, please. There are some differences in patterns of use between medical cannabis and recreational cannabis. Generally speaking, when people are using medicinally, their intent to use is not to get high. They're actually not looking for impairment. They want to stay functional. They're generally microdosing, which means they're using just a little bit of whatever product formulation that is preferred for them, a little bit in the morning, a little bit in the evening, preferably just a little bit in the evening because there's a less risk of loss of functionality during the day. 90% of cannabis medicinally is oils and vaping, as opposed to smokable products. Smokable products are never recommended because of the known negative effects on respiratory health and the risks of respiratory illness and cancer when anything is smoked, burned, and combusted plant material is smoked and inhaled. We do largely see people using strains that are CBD dominant or have a good amount of CBD in them. Technically, traditionally, people are using that product for themselves. They're not really sharing or diverting or, giving away or selling to other people. Interestingly, the largest growing cohort of medicinal cannabis users are the baby boomers, ages 55 and up. Since legalization occurred, they're actually the fastest growing group of utilizers in our community. Also baby boomer females, really fast growing group of cannabis users medicinally. And the four top issues that people present with are pain, sleep, anxiety, and trauma. Next slide, please. When individuals are using recreationally, we see a pattern where they tend to seek the higher, the euphoria. They're macrodosing versus microdosing, so they're using a lot, either in binge amounts or spread out throughout the day. There's a predictable, defined pattern of their use. They're using higher risk methods and products. They're seeking out higher potency THC products. That tends to be the preference. We do see the sharing and diverting of cannabis products. This is more common in youth and adults. And anyone who's using cannabis in a regular, consistent pattern, there's about a 25 to 30% risk of developing a substance use disorder or dependence, and therefore experiencing withdrawal when you stop using, if cannabis use is regular. Some people are also self-medicating, right? So there can be some kind of mixed motivations for use. People's use is never really driven by one motivation. There are always multiple reasons that people might choose to use, and they might choose to use cannabis on different days for different reasons as well. So it's not simply for fun, and it's not simply self-medicating. Every person has their own unique relationship with cannabis. Next slide, please. There are some medical considerations. One is that, as I mentioned, research and pharma need to catch up, right? Research communities are playing massive catch up, right? The illegal nature of cannabis for quite some time really prevented a lot of good research, good quality research from happening. Some of the other considerations that are concerning to me are that patients can be assessed remotely over internet-based medical cannabis medical platforms, and so they're not actually being seen in person. I tend to be a little bit biased as a psychotherapist. I like to see people in person. Telehealth is a great convenience, but ideally, I think in-person assessments are kind of the way to go. There's very little monitoring of dosage or formulation or strain availability by a prescriber. Once a prescriber is giving you your green light to obtain your medical license, then you're really able to go to a medicinal pharmacy or recreational pharmacy, and it's a lot of trial and error around what's going to work for you and what isn't. Not all prescribers provide education around the risks of dependency or the possible side effects. There are negative effects into adulthood, and those should be discussed with all patients. And there are also medical cannabis recalls and recreationally licensed product recalls from time to time. So medical patients do need to consider staying well informed, educating themselves, being aware of whether or not certain products have been recalled because of, contaminants or, higher than, acceptable levels of pesticides in products. All of the products that are available come with their own risk benefit profile, and each patient needs to kind of weigh that out for themselves. Next slide, please. Just a few more medical considerations. There are lots of cautions around anyone who's prescribing under the age of 25. There is evidence that is mixed and sparse around the benefits of THC products being prescribed to individuals under the age of 25 because of the risks to brain development that usually outweigh the benefits, right, of the prescribing. CBD, on the other hand, there are CBD products that are FDA approved for the use of seizure disorders in children. But now any qualifying medical condition is at the discretion of the provider. So a medical cannabis provider is no longer limited to wasting syndromes and PTSD as, disorders that they can prescribe for. They can now make the determination themselves clinically if something meets the requirements for cannabis as a helpful treatment or therapy. Dosing is very tricky. Like I said, people have to experiment with multiple products, multiple concentrations. We encourage people to start low and go slow, and then to stop when they get where they needed to go, right? So that's the other thing, is stopping, right, when you get the relief or you get the medicinal benefit that you're looking for. Next slide, please. There are lots of different ways that people can use medical cannabis. And again, the safest possible method really depends on the individual. If someone has respiratory issues, then we would highly discourage vaping or smoking the cannabis flower. If people have significant risks for comorbid mental health concerns, then we would really encourage lower potency products that have lower THC in them. But there are a variety of ways that cannabis products can be used that don't involve smoking, and generally medicinal methods are discouraged when it's, a smokable form, because like I mentioned, there are significant respiratory health concerns. We don't want to worsen the health of this patient. We want to improve the health of that patient. Next slide, please. One of the things that people have very little awareness of in the community is that there are over 387 drug interactions with THC cannabis. So out of those 387 drug interactions, 26 are considered to be moderate to severe, where the warnings actually and the risks outweigh the benefits. So the greatest contribution that cannabis has around creating, contraindications is just around its depressant effects. It can be sedating. It can cause people to become drowsy. Mixing cannabis with other medications that also affect your central nervous system in a depressant fashion are not recommended, right? We really want people to be able to stay alert as much as possible, unless they're using THC for sleep. And so we don't want people to become overly sedated and then experience adverse reactions because of that. Combining alcohol and cannabis is never recommended. It causes the spins, and it can result in dizziness, drowsiness, confusion, and difficulty concentrating. Next slide, please. There are some very, very common medications that are contraindicated with THC. So those include Viagra, warfarin, which is a blood thinner, benzodiazepines, Prozac, which is a very common antidepressant, and Depakote. So if you know of any individuals that are on these medications and they're also regularly using cannabis, there could be some unwanted side effects, or a decreased effectiveness of those medications, or an increased blood volume of those medications because of the impact of THC being in the system at the same time. So Prozac, for example, when combined with use of THC, can put somebody at greater risk for serotonin syndrome and or a worsening of mood. Some cases we've seen increased risk of psychosis and mania. So again, just really being mindful of some of these contraindications. And again, most people are not aware of this stuff. All right, next slide, please. We're going to talk, and the next slide, please. We're going to talk a little bit about the downsides of cannabis in terms of the not so great impact across the lifespan. So every single one of us has natural cannabis floating through our system at all points of the day. We have a natural cannabis system. It's called our endocannabinoid system, and it is responsible for a variety of bodily functions that range from like immunity to bone health to brain development and appetite, right? Temperature control, blood pressure control, all of these incredible things our endocannabinoid system does. Next slide, please. And just because cannabis is legal does not mean that it's safe for everyone. So given that we all have an endocannabinoid system and we can all be affected by THC being present in our body and how it interacts with our endocannabinoid system, there are certain populations where it is not recommended to be using. If you are seeking to conceive, if you're pregnant or breastfeeding, if you're under the age of 24 or 25, if you are middle-aged and potentially struggling a little bit with memory, if you have pre-existing cardiac conditions or pre-existing severe and persistent mental illness, or a family history of severe and persistent mental illness. So I'm going to get into some of the details with this now. So next slide. Smoking, both cannabis and tobacco, is actually the largest contributor to infertility problems in North America. So fertility is impacted in terms of both the egg health and the development of sperm. The benefits for men who are smoking cannabis, choosing to discontinue while they're trying to conceive, is that sperm does regenerate, sperm does grow back and kind of like turns itself over every couple of months. So when people stop using cannabis and they give themselves a little bit of a break, up to 3 months, their sperm can kind of grow back healthy again, which is great. However, for women, it's a little less easy. There's damage to egg health. Conception can be difficult and longer. There is a 2 times greater risk of embryo implantation not being successful and or miscarriages. Cannabis can disrupt ovulation, and fewer eggs can be retrieved during IVF when a patient is a cannabis smoker. Next slide, please. During pregnancy, the message here is that there's no safe amount of cannabis to smoke during pregnancy. And, surprisingly, but not surprisingly, any country or state that legalizes tends to see an uptick in cannabis use during pregnancy, either because of increased access or because of changing societal norms or, changing attitudes and thoughts around the perception of safety with cannabis. But use during pregnancy is most often cited as a way to reduce nausea or vomiting. However, there is a much increased risk of stillbirth, preterm babies, lower birth weight, and the need for neonatal care. There's also correlations between cannabis use during pregnancy and autism diagnoses after the child is born, and also a greater risk of sudden infant death syndrome. Next slide, please. So there is a movement called Ganja Mamas, where communities of moms get together, both pregnant and parenting moms, who really strongly believe that cannabis is beneficial to themselves, beneficial to their physical and mental health, and helps them in their role as a mother. So about 5% of women in the US do report smoking cannabis when pregnant. It is the most commonly used illicit drug during pregnancy. At least that's a stat in Canada. There is no safe amount, as I mentioned, and the effects on neurocognitive development through the child last throughout their lifespan. So we know that fetuses exposed to THC in utero end up having greater risk of problems related to memory, focus, concentration, learning, IQ, verbal fluency, and they're at a greater risk of developing a substance use disorder or a dependency before the age of 18. Compared to children or fetuses that were not exposed to THC in utero. Next slide, please. So the neurocognitive impact of cannabis while the brain is developing, and that's anywhere from age 0 to 24, 25. While the brain is developing, there is a significant neurocognitive impact to THC exposure, and that includes all of the things that I kind of just listed off that we see in, children exposed in utero, as well as children who are actively using, especially while their brain is in this sort of final stage of brain development, this critical period between the ages of 12 and 24. We see all of these concerns and deficits, and it really impacts that young person's ability to be successful with their life goals. And these deficits are also not temporary, right? Your brain only has one chance to grow, and you need your brain for the rest of your life. So when all of your outside cannabis is flooding your brain, your endocannabinoid system doesn't get a chance to do its job. And the endocannabinoid system is actually responsible for that final push towards brain development. So next slide, please. The endocannabinoid system is responsible for neural proliferation, which means that more neurons grow and expand, and the dendrite of each neuron, like a tree reaching to the sky, gets to grow really tall and strong. We see a thickening of the cerebral cortex, which is a good thing. We see pruning away of connections that we don't need, and really a proliferation of white matter. The flooding of the brain, like I said, with outside cannabis really interferes with this process. And the next slide will show what some of those interferences look like. So we see less control of emotions, right? Young people have a harder time managing big emotions. They have deficits in executive functioning. They're not as great with problem solving and thinking through the consequences of their actions. Their learning is slowed down. Their verbal comprehension and fluency is disrupted, and they tend to have poorer memories. On top of this, the next slide shows that individuals who use regularly during their adolescence and during this period of brain development can lose up to 8 IQ points. These are eight IQ points that you do not get back. These are unrecoverable IQ losses, and that is a huge concern. Again, the 8-point drop is at kind of like the most extreme. It can be anywhere from a 2-point to an 8-point IQ drop, but this is a significant concern. So the next slide shows that, youth who are using do have a bit of a hazy future, right? There's a 60% less likelihood of obtaining a college degree, lower life satisfaction, difficulty achieving life goals, and young people become dependent on THC faster than adults do. And that's because their brain is still developing, right? And because their brain is going through this massive growth process, it's also very sensitive to the effects of dopamine and sensitive to the effects of any psychoactive drugs that are exposed. And so we do see young people developing addictions to THC faster than their adult counterparts. So the most alarming statistic on this is that 70% of youth who are exposed to substances before the age of 13 will develop a substance use disorder by the age of 20. And that is dramatic. And so we know if people could either just delay or reduce, right? Change up their frequency, consider waiting, right? That has a really significant impact on their brain health and their wellness as they progress throughout, their growth into their adulthood. Okay, next slide, please. There are some negative effects that kind of impact everyone, regardless of what age you are. And one of those things is amotivational syndrome. So when people are using cannabis regularly, they are at risk for symptoms that mimic depression. We call this amotivational syndrome. It's a combination of anhedonia and apathy, lack of goal-directed behaviors, lack of emotions or emotional blunting, and decreased interest in doing things. So I love this slide. It says the good thing about weed is that it makes it so your problems don't bother you. And then the bad thing about weed is that it makes it's so that your problems don't bother you, right? So it's a good thing and it's a bad thing, right? The number of patients that I've had over the years that have smoked cannabis regularly for about a decade, let's say from age 15 to 25, I'm chatting with them when they're 25 and they're like, haven't really done much with the last 10 years. I'm still sleeping on the couch in my parents' basement and I haven't really achieved my life goals, right? So there is that lack of goal-directed behavior and a difficulty initiating new tasks and seeing them to completion. Next slide, please. There is also over 30 years of well-constructed, well-documented research linking cannabis use and psychosis or psychotic illnesses or psychotic-like symptoms. So cannabis is a known modifiable risk factor for psychosis. So psychosis is a serious mental disorder where thoughts and emotions become impaired. And there is a much greater risk of developing psychosis if a young person is using cannabis in their adolescence, while their brain is still developing, and that risk increases the earlier the person starts using. So for example, if a young person is using before the age of 15, there is a 4 times greater risk of developing psychosis in your 20s. If a young person uses before the age of 13, there's an 11 times greater risk of developing psychosis in your 20s. And so early use is the primary risk factor there. Next slide, please. Regardless of age, cannabis use is connected to a couple of different mental health conditions. So we know that THC cannabis can worsen symptoms of anxiety, depression, suicidality, symptoms of psychosis, and symptoms related to schizophrenia. Again, these negative effects are very dose dependent. So one of the things I would have touched on in the first presentation is that the effects of cannabis are dose dependent. At low doses, it tends to be more therapeutic and a little bit more pleasurable with less negative side effects. At higher doses, we see cannabis really interfering with the with exacerbating mental health symptoms in these areas. Okay, so who is at risk? That's the next slide. Individuals are at risk for developing, mental health concerns or unwanted consequences related to their cannabis use. Like I said, if they are early users, frequent and chronic users, if they're using very high potency products, if there's a history of mental illness or substance use with the family, if the individual is very stressed out and not coping well, and if there's pre-existing mental health concerns. So again, the next slide kind of speaks to what I already kind of mentioned about the risk of early use. So I'm going to jump ahead to slide 38, which is jumping ahead to middle-aged brains. So for those who are in their middle age, I don't know what we classify middle age as these days, because like I'm middle age and I don't really feel like it yet. But regular use in middle age can result in a 5.5% IQ drop from where your IQ was in childhood, and there can be memory and attentional issues experienced as well. The bigger concern with regular cannabis use in middle age is that if you're having problems with memory and focus and concentration, that actually puts you at risk for earlier onset of dementia and cognitive problems related to aging. Because if you don't use it, you lose it, right? And if cannabis is impacting your neurocognitive abilities, then it puts you at greater risk for developing earlier onset cognitive issues related to age-related cognitive decline. There are also some physical health effects that are for all ages, including overdoing it, right? Kind of greening out. There are toxins and carcinogens present in the smokable products. There are respiratory illnesses, weakened immune system, skin aging and damage, mouth and gum disease, and some cardiac effects. The cardiac effects include, on the next slide, reduced blood vessel function and a variety of other cardiac conditions. All you really need to know is that using cannabis increases your risk of heart attack by more than double if you are a cannabis user. So anyone who has a pre-existing heart condition, anyone that you think may be experiencing any kind of cardiac symptoms and is also using cannabis, we really want to encourage them to be aware of this, possible concern. And this is attached to not just smokable products, but a new study came out just this past month highlighting that edible cannabis products can also increase your risk of heart attacks when using cannabis because of the impact on your blood pressure and your heart rate. And there is some evidence to suggest that there's also an impact on cardiac arrhythmias and risk of myocardial infarction. And then the next slide really just talks about some of the vaping risks, right? That's one of the hugely popular, methods of use, which is a concern because vaping comes with risk of heavy metal contamination, leaching from the vape components, again, toxins and metals leaching from the vape itself into the juices. There's also concerns around second and third hand smoke, respiratory health, and kids and pets exposed to the secondhand aerosol. Again, it is not water vapor, right? It is secondhand smoke, and that impacts the respiratory health of other people in your environment, especially if smoking is happening indoors. And that can lead to respiratory issues for the individuals using the vape as well. There's a vaping disease called EVALI, which is important for people to be mindful of. And there's an environmental impact as well because the vapes are not usually properly disposed. Vapes are tricky because they're a combination of electronic waste because of the battery, but also biohazard and medical waste because of the vape cart and the juices and the THC content. So they're really tricky to dispose of. We do encourage people to return them to a pharmacy, right? Separate the battery out, right? Give the battery to Home Depot, have them do the electronic waste piece for you, and then the rest of it can be disposed of at a pharmacy. The next slide talks about another unwanted consequence of using cannabis frequently, and that is a disorder called cannabis-induced hyperemesis or hyperemesis. This is a cyclical vomiting syndrome that occurs when people are using cannabis for long time frames and in higher amounts. This is an intractable nausea, and it lasts for several days at a time. Individuals risk becoming dehydrated. They also often have to seek medical attention. We do have receptors for cannabis in our gut, and when there's too much cannabis in our system, those receptors can get kind of out of whack, and it can cause this persistent vomiting syndrome. The best treatment for the syndrome is really abstaining or reducing to kind of get your body regulated again and allow some of the THC to deplete out of your system. And oftentimes people do seek medical attention. They think they have a GI infection or some other terrible case of the flu, when really it's the cannabis that's inducing, right, the vomiting syndrome. Next slide is just a quick explanation of epigenetics. And so again, I'm not a genetic scientist. I don't have all of the information on this, but we do know that when people use something on a regular basis, it does have the ability to alter our DNA. And we do know that there are epigenetic effects associated with the use of cannabis. This means that our, cannabis can damage our cells' genetic information, and that can lead to DNA mutations, accelerated aging, and cancer. And some of these epigenetic changes can also be passed on through our DNA to future generations. So we need to do more research on this, but more recent discussions in the scientific community have touched on some of the epigenetic effects related to cannabis. So I realize that we are, there's so much to cover in any cannabis presentation, and we've got about 15 minutes till the end. So I just want to check in with our wonderful hosts here to see if we should open it up for discussion at this point, or if you'd like me to kind of keep going.
I think you could probably maybe talk about legalization for a few more minutes.
Okay, awesome. So we'll get to the legalization piece. The thinking around legalization is multifaceted, right? There are lots of different kind of motivations and reasons for why a country or a state might choose to legalize. The changing legal status of a substance does not alter its medical risk or benefit profile. And that's a really important point that I like to drive home. So many of the patients and families that I've supported since legalization have struggled to kind of conceptualize this, right? Just because its legal status has changed doesn't mean that the chemical composition of the substance has changed. In fact, it's actually become more potent, right? And there are more products available on the market right now. The legal status doesn't change how the plant grows, right? And how it impacts our body neurochemically. So what is legal right now? What is legal right now is that individuals can possess 3 ounces of cannabis flower or up to 24 grams of concentrates. People can also grow at home. I don't know if anyone has any neighbors growing at home or anyone in your area, but if you're not managing the ventilation well, it gets really skunky. As we've mentioned, it can be very, very pungent. It is essential to know that there are some places where you cannot smoke cannabis. It is not legal to smoke in a motor vehicle cannabis. It is not legal it is legal to smoke in a private home. Sorry, that's an error on my slide, but it's also not legal to smoke on any federal property or at a place of employment or a school. So public spaces, not great. It is legal to share with other adults who are 21 years of age or older, but selling without a license or gifting to other people by sharing stickers, which is what some of the illegal smoke shops have done, is not legal, and is also not legal to sell or to share with minors. So I had a conversation with some individuals that work with a youth organization, and a lot of people actually don't know that the legal age is 21 because it's so accessible and so many people are actually using. There's actually a perception that the legal age is younger than what it is. but the legal age is technically 21. So the most safe place to be consuming cannabis is in a private home, although we don't recommend smoking indoors or vaping indoors ever, and on your own private property. All right, next slide. There are some benefits to legalization, and those benefits include consumer safety. All recreational and medical cannabis in New York State is tested for a variety of contaminants and potentially harmful byproducts. And so there's increased safety, there's ease of access. Like I said, there are many, many dispensaries available. So many people raised their hand to say that there was one in their area. There's more product variety. There was a social justice component to the legalization legislation that was rolled out, where individuals who were disproportionately impacted negatively by previous cannabis laws now had an opportunity, a preferential opportunity to become business owners in this industry. There's tax revenue, job growth, reduced stigma, and some research advancements that can take place. Next slide. So in terms of consumer safety, these are all of the things that licensed cannabis growers and cultivators have to test for. So that includes how much cannabinoids are in that product. So how much THC, how much CBD, what's the ratio? Are there any heavy metals, bacterias, mycotoxins, which are byproducts of mushroom and fungus materials that can be toxic to humans, that are present in the soil that the plant might be grown in. There are residual solvents that are used when it's, the product is being extracted from plant to oils, pesticides. And what I learned from visiting the dispensary in my neighborhood is that all of their products have a QR code on them where you can scan the QR code and it tells you exactly everything you need to know about that product, and you can track it from seed to store. So you know exactly what happened with that product through its growth and cultivation and manufacturing process, which is super interesting. There are some cannabis trends that we've seen that have come with legalization, including strong black and gray market sales. There are lots of underage sales without penalty. I have numerous 14-year-olds on our Safer program caseload who have no difficulty accessing cannabis daily from sources that are willing to sell to them. And it's not just peer-to-peer selling, it's smoke shops as well that are selling to underage consumers. We're seeing high potency THC products, and those are called dabbing products. These are concentrates that look like oils, waxes, and resins. We're seeing a decline in smoking flower, interestingly. So less people are smoking, more people are vaping, and more people are using edibles. But there's also a very low consumer product awareness, right? When people are still purchasing from the black or the gray market, they don't know what they're getting. And they know that it's safe, and they know that, they can access it safer. They believe it's safer. They know they can access it, but they don't really have good product awareness. And there's really mixed economic benefit, right? From legalization. It's, cannabis, the legal cannabis is more expensive, right? The black market and the gray market is still alive and well, right? That hasn't really changed. Next slide. Just a quick note about some unintended consequences. Because of that growing perception of safety, we're still seeing an increase in drug impaired driving offenses related to cannabis. We're seeing a lot of unintended exposure with children and pets. So the amount of cannabis being brought to school, middle schools and high schools, and shared among peers has increased. In Canada, at least, there's been a 70% uptick in children presenting to the ER with unintended ingestion of cannabis products. We're seeing, an increase in rates of youth mental health and a double in the rates of prenatal cannabis use. And those are a concern, right? Because we know that those are populations that cannabis is not well suited for, that there can be significant risks and harms to development with individuals using cannabis, either pregnant or under the age of 24, or using while driving, right? That puts everybody at risk when that happens. I'll speak to, maybe if you could jump to just slide 54. Actually we'll do slide 51, the perception of safety. And then we'll jump to kids don't know the difference. So the perception of safety is influenced by obviously what youth and parents are, learning from media messages. And there are a ton of cannabis billboards around our community. And we know that research has shown that the presence of cannabis billboards does have an impact on youth perceptions of cannabis safety, and youth perceptions being positive around cannabis safety increase their expressed intentions to use when they're able to. So we know that billboards and advertising have an impact. We know that the Clyde survey data, a lot of the schools in the area have completed this survey, which assesses for perceptions of safety. And by the time a young person reaches grade 12, they have they're much more likely to perceive cannabis as being safe and perceive that their parents would be okay if they smoked it. And so there's a big jump between, perceptions of safety between, a grade 8 student and a grade 12 student. And if we want to jump to slide 54 just quickly, the risk of young people perceiving cannabis as safe and the risks associated with cannabis products being so widely available in the community is that kids don't know the difference, right? These are all THC products that are marketed and branded as though they are regular treats and snacks that you might just pick up at Wegmans or Tops, and kids really don't know the difference. And so the risk of unintended ingestion for children is significant. It can result in acute toxicity, affecting the heart and breathing and also the brain. Changes in alertness and motor coordination. In severe cases, children do require ICU admission because of risk of seizure activity. And this packaging is really dangerous, right? And not only is it dangerous because it's misleading, but these products are also extremely high potency. And so we encourage, in terms of safety, we encourage, all cannabis products to be locked up and kept out of sight of anyone who is under the legal age to be using. So I am going to pause there for the sake of time. I know we've got a couple of minutes left here. There is another section on harm reduction we just didn't quite get to, but who knows, maybe I'll be asked to come back a third time. That might be ambitious of me, but I'm always trying to get so many good messages into one presentation. It's tough to cover everything, but this presentation can certainly be emailed out to any participant who's interested in seeing all of the information. There are lots of harm reduction strategies that can improve the safety of the individual user, as well as the safety of the community and the safety of our children. So please take some time to view the rest of the presentation if it gets sent out to you.
Yes, thank you so much, Erin. Great presentation. Just a few notes and then we'll take some questions. The copy of the slides and the presentation will be posted to our website. That is one of the links that I put in the chat. So that is usually posted within the next couple of days, so everyone will have access to that. I did also post the link for our evaluation, and we would just appreciate if you take a few quick moments to fill that out. And the last link that I posted was our July session, which is an introduction to our mental health crisis triage tool, and the registration link for that. So we will open it up for questions. I did see one that came in already that I just wanted to go back to, and it was a question about dispensaries on Native American land.
Okay, that is a very complicated question, and so native tribes have their own legislation, their own laws. There is no federal oversight, right, for those reservations, and so the dispensaries that have popped up on the reservations are not regulated by New York State. The products that are available on those reservations are imported from all states. They're not exclusively just coming from New York State, which is also not technically legal. So the product variety is different. They're able to offer cheaper prices because they're getting things in, from other sources. The only concerns that I've heard of from all of the clinical work that I've done and all of the networking that I've done around cannabis in the area is that the contamination concerns around like fentanyl contamination, or cannabis products causing other kind of bizarre, unwanted reactions like, young people vaping and losing consciousness, or contamination with amphetamines. All of the reports that I've had are consistent with those products being obtained from reservation dispensaries. So please use caution if you're obtaining from a reservation dispensary. I don't want to paint them all with the same brush. I haven't visited every reservation. I haven't visited every dispensary. Some are probably more safely managed than others. But the safest possible source is a New York State licensed dispensary. The reservations are also selling very routinely. Some of them are selling very routinely to underage customers as well. So lots of risks there, and not a lot of solutions. Although I have heard that some of the bans, native bans, are starting to put more safety measures in place and maybe crack down on some of the dispensaries that have been selling products that are less safe. So we'll see how this evolves over the next little while.
Thanks. Another question, dollar to dollar, how does street cost compare to dispensary cost?
Oh, okay. So that is really interesting. The street cost of weed hasn't really changed that much over the last little while, and like inflation hasn't really impacted it, which is interesting. So you can usually get like like 2 grams, a gram or two for like, $20 to $30. And at a dispensary, they have a whole range of products, right? So you can either get a pre-roll for $7, which is like one joint or blunt pre-rolled, or you can spend up to $100 or more, right, on a particular product. Street pricing is always more competitively priced, right, than licensed dispensaries. There's also a lot of overhead costs and production costs that go into the dispensary weed. Interestingly, I was talking to my local dispensary owner the other week about this, and being on the west side, they've intentionally lowered their prices and have taken a bit of a cut because they want the community to access safer products and be less likely to use street products or products from the reservation or products that are contaminated. So they've actually lowered their prices just to improve the safety of the community and give the community better access. So their cheapest item is $7, and then their most expensive item is into the hundreds.
All right, thanks. Another question, what are we seeing with regard to lacing?
Oh Lord. Okay, so lacing can happen with joints or blunts, and typically it's a joint or blunt being laced with cocaine. That's the most common substance that is laced. And then anything that has cocaine contamination is also at risk of fentanyl contamination, because the majority of cocaine in our area is fentanyl contaminated. So there have been concerns related to people using smokable products that have then resulted in an overdose because of that lacing, because of that contamination. The other thing that we're hearing is with the vape devices, if they're being obtained from unregulated sources, and a new trend that I've been made aware of in some of the school communities is that people are taking old vapes and repurposing them and refilling them with new juices and new products. And those vapes have been causing some adverse reactions, but we don't exactly know what is causing that reaction. It's not a fentanyl type overdose reaction. It's more like losing consciousness suddenly and being unconscious for a period of time, but not losing respiratory function. So I don't know what that's all about yet. That's sort of a new thing that we've been seeing. And there's also been some reports of amphetamines being laced in the unregulated vapes. And so there's more research being done on that. If you have access to vapes and you're worried about what's in it, Roswell is doing a research project right now where they're analyzing the content of vapes that are being found in our area. If anyone's interested in that information, they can reach out to me directly, and I can send them all of the information for Roswell, or I can also give it to the organizers and you guys can post it as well. But Roswell is doing a research project on that, simply because we don't know what's in them, right? We have some guesses, but unless we're actually analyzing the products, we don't really know definitively.
We do have more questions that came in, Erin, and I want to be cognizant of your time.
I have till 1:15, so I'm good to keep going.
Do you want to take a few more? Because we could always have people email you if they have more questions, or I can go through a couple more.
Let's go through a couple more.
Okay.
Yeah.
If people want to stay, sure. Can you overdose on THC, or is it just being too high?
It is just being too high. You cannot physically overdose on THC. You would have to smoke 1,500 pounds of cannabis in 15 minutes to overdose, to overwhelm your endocannabinoid system enough that you would have a fatal reaction. So, what we typically see is that people, when they smoke too much, they green out, right? Their endocannabinoid system becomes overwhelmed and they feel sick. They might vomit. They might have limb heaviness. They might have some blood pressure, temperature stuff going on. They might feel super anxious or paranoid. The You cannot overdose in the true sense of the word overdose because there are no cannabis receptors in your brainstem, right? Which is back here. But unlike opiates and alcohol, which do have receptors back here, right, that control your respiratory functions and your cardiac functions. So with cannabis, you cannot physically overdose, but that doesn't mean that fatalities don't happen. So in terms of risk, though, we also want to make sure that people are aware that cannabis impairment can lead to fatality through impaired driving, through death by accident or misadventure, through misperceiving your environment. And from people developing acute crises, mental psychiatric crises, maybe acute psychosis, and then having some like strange ideas or beliefs that could lead to harming themselves or other people. So there are fatality risks. They're just not directly related to overdose. If there is an overdose death related to cannabis, it's likely because it was contaminated.
All right. How do you differentiate original snacks from containing snacks when packaged similarly?
Well, reading the package is like the number one recommendation. They look very similar, and adults can tell the difference, right? Adults can read the package and see Oreos versus Stonios, right? Or like Sour Patch Kids versus Stony Kids. But young children are not going to be reading the package, right? So that's one of the reasons that we need to keep the packaging and these products away from children, away from their ability to access. Um, Really, it's being mindful of, if you're taking somebody from some snack offered by another person, check to see where it came from, right? Be mindful of that. There have been lots of examples of adults having unintended ingestion as well, where they're given cookies or brownies or treats of some kind, and then later they find out that there's cannabis in it, right? After they're having an adverse reaction. So I think the message really across the board, no matter what the age is just be really mindful of what you're putting in your body. Just be really mindful of what you're consuming, and please read the packaging, right, on any snack that you find. A cannabis infused product has to include the THC content, the CBD content, and all of those other things. It should have that clearly stated on the label. Oh, I can't hear you anymore.
Sorry about that.
It's okay.
You want to take one more?
Yeah, let's do it.
All right. What reports have said that cannabis from the reservations is contaminated with fentanyl?
So the OCM puts out reports regarding their products, and so the OCM has been very, very clear to say that any concerns related to contamination have not been related to OCM licensed products. The Erie County Department of Health puts out warnings around products, and so we do get from the Harm Reduction Network, we get alerts that come through indicating when there have been fentanyl contamination occurrences or kind of pockets of these things happening. So I would pay attention to the Harm Reduction Network and also with your organization as well. I know you guys put out alerts too from time to time. Again, the reports around contamination are very sporadic, and it is hard to kind of pin down where this information is coming from. But I can tell you that clinically, what I'm hearing from my patients is that it's happening often. We also don't get really definitive answers until we get a report from like the coroner, right? To say like how many overdose deaths in New York were related to, a particular, drug or a contaminated drug. We do know that cannabis, there have been coroner's reports that have indicated cannabis as a secondary cause of death in a number of deaths each year. So this is just all kinds of epidemiological and population related data that you kind of scrounge up from different sources, but those are some of the sources.
And one last question, asking for additional information or additional sources for the cannabis hyperemesis syndrome, if you have any additional
Oh,
sources.
yeah, I can send some information and some articles your way to the two of you, and then you can post that information. It's actually really easy to find. It's a very well documented side effect of cannabis. So there are a lot of reputable medical websites that have posted about this and lots of research articles. So a simple Google journal search is going to pull up a lot of good stuff. But I can send a few choice things your way to review.
And just looking at the time again, it looks like there's still probably a few more questions and a few people looking for more information, but my suggestion would probably be to have them email you. Is that okay, Erin?
Absolutely. Yeah, that's not a problem.
Right. And we will post anything that you send over, and people can
Okay.
access it via our website.
Excellent. Awesome. Thank you so much for having me. I know that there's a lot to digest here, and I just thank everybody for being so cannabis curious and having so many amazing questions. It really makes my day to be able to, provide this good information and help improve everybody's awareness.
Yes, thank you again for your time and for such a wonderful presentation. I did post the link to our evaluation again for anybody who hasn't filled that out yet. And thank you. Thank
Okay.
everybody. Yep.
All right. Thanks so much. Have a great day, everybody.
Bye-bye.